When responding to a medical call for service, please consider the following. If multiple officers are responding to the scene, try to limit the number of officers that enter the residence or building. When possible, try to treat the patient outside. And is there any CAD information that may indicate the need for additional precautions or the potential for CPR? If the answer is yes, consider donning or carrying your assigned N95 mask. When responding to any medical call, the minimum PPE recommendation is 1. Eye protection, surgical mask, and gloves. When possible, try to avoid standing directly in front of the patient and maintain at least 6 feet of distance. However, if additional assessment or intervention is necessary, this may be impractical. When fire arrives, they will first utilize the same minimum PPE recommendations, maintain 6 feet of physical distance from the patient when practical, offer or place a surgical mask on the patient, and move the patient outside when possible. In situations where fire will be employing aerosol-generating procedures or care activities where splashes and sprays are anticipated, they may ask officers to leave the immediate area. If the officer is unable to leave the immediate area, an N95 mask, eye protection, and gloves are required. We will discuss how to properly don and doff a new N95 respirator and a previously used N95 respirator that has been properly stored. Let's begin with a new N95 respirator. First, be sure that your hands and gloves have not been contaminated. If they have, remove your gloves, wash or sanitize your hands, and don a clean pair of gloves. Put on NIOSH-approved N95 filtering facepiece respirator. If the respirator has a nose piece, it should be fitted to the nose, not bent or tented. The respirator or face mask should be extended under your chin. Both your mouth and nose should be protected. The respirator or face mask straps should be placed on the crown of your head and the base of your neck. Perform a user seal check each time you put on the respirator. If your respirator or face mask has loops, hook them appropriately around your ears. Then, put your face shield, goggles, or other appropriate eye protection on. Now let's look at how to don an N95 respirator following the CDC's reuse guidelines. Please note that according to the CDC, there is no way of determining the maximum possible number of safe reuses for an N95 respirator as a generic number to be applied in all cases. Safe N95 reuse is affected by a number of variables that impact respirator function and contamination over time. However, an N95 respirator should be discarded under the following conditions. Following use during aerosol-generating procedures, if it's contaminated with blood, respiratory or nasal secretions, or other bodily fluids from patients or subjects, following close contact with any patient or subject co-infected with an infectious disease requiring contact precautions, and if the respirator is obviously damaged or becomes harder to breathe through. Now let's don the respirator. First, be sure that your hands and gloves have not been contaminated. If they have, remove your gloves, wash or sanitize your hands, and don a clean pair of gloves. Avoid touching the inside of the respirator with a contaminated glove or hand. If inadvertent contact is made with the inside of the respirator, discard the respirator and use the next available resource. Put on the NIOSH-approved N95 filtering facepiece respirator. If the respirator has a nose piece, it should be fitted to the nose, not bent or tented. The respirator or face mask should be extended under your chin. Both your mouth and nose should be protected. The respirator or face mask straps should be placed on the crown of your head and the base of your neck. Perform a user seal check each time you put on the respirator. Remove your gloves and wash or disinfect your hands anytime you touch or adjust the outside of the respirator or mask. Don a new pair of gloves and put on your face shield, goggles, or other appropriate eye protection. As previously discussed, any activity that would employ aerosol-generating procedures or care activities where splashes and sprays are anticipated, an N95 respirator is recommended. In these situations, a surgical mask should only be used if an N95 respirator is unavailable. When doffing your PPE equipment, please properly discard all contaminated gloves, don a new pair of gloves before removing your eye protection, remove and clean your eye protection prior to storage, remove your respirator or mask without touching the inside of the device. If possible, fold the respirator or mask in a manner best suited to protect the inside of the device. Carefully place the respirator or mask inside a paper bag, and do not place multiple respirators or masks inside a single bag, one device per bag. For further information on proper PPE use, please visit the Gilbert Police Department SmartForce page.